Hi, everybody who's just joining us. Welcome to the webinar. We're going to get going in a minute or two, just allowing people to get on. If you're watching the recording, there'll be about 30 seconds a minute before we get into the content. So just bear with us as people are joining us.
It's a shame we don't get to see everybody, isn't it?
Oh, I know. Already up to 60 people live.
Great.
So
hi, everyone.
Great international. Just give it another 30 seconds or so for everybody to sort of just catch up, ready for the start, and we'll get going.
So where are the most of the attendees from, Dom? Is it international?
International, yes. I'll get into that on my introduction in a second. So we're just going to get going in 10 seconds. We're up to about 80 people now. So okay, so we're going to get going. Hello and welcome everybody to the webinar this evening on improving patient outcomes after cosmetic surgery with lymphatic drainage with Kathleen Lisson. Tonight, I'm really excited to bring you this international webinar. We have people joining us from all over the world, from the UK, the USA, Canada, and Europe. So thank you all for joining us this evening in the UK, morning, or wherever you are in the world or what time it is. So for the webinar this evening, we're going to be split into two sections. We have a 20-minute presentation from Kathleen, and then we're going to have a Q&A session where you can pose your questions and we'll get them answered for you. So the session is being recorded, which you will get access to afterwards. We will send you in an email. So if you do miss anything, you can watch it back in your own time. If you do have any questions, then please put them in the question and answer function that you'll find at the bottom of your screen. And for anybody who is watching the recording, if you do have any questions, then please feel free to submit that to us via our email, which you can find in the description below. So a couple of quick introductions. My name's Dominic Smith. I'm the Clinical Application Specialist at PhysiQuip. For those of you who are new to PhysiQuip, we're a UK-based medtech distribution company, and our aim is to improve the standards of rehabilitation by introducing some of the world's leading technologies into the UK market. Also, from an education perspective, we like to bring some of the world leaders in their areas to the platform to share their experiences, hence this webinar this evening. So with that said, I'd like to introduce Kathleen, who's joining us from Solace Massage and Mindfulness in San Diego, the States, who will be presenting in a moment. And I'd also like to introduce Petra Irving, lymphedema therapist and scar tissue therapist based in the Northern Ireland in the UK, who's going to join us for the question and answers at the end. And the reason they're both on is we realise that there are a variety of regulation differences between the USA and the UK, so we wanted to ensure that both territories were represented. If you're obviously outside those areas, we'll try and get any questions answered as best as we can. Before we do start, we'd like to just drop a quick poll so we know who is on the session. So the poll's just going to pop up now for you. So if you could answer these questions: what is your job title, and whether you currently treat cosmetic patients. So we'll leave this up here for about 10 seconds. If you just take a quick second just to answer those, and we'll get some results and feed that back to Kathleen. Another 5-10 seconds and we'll drop that down. Getting some answers in. Okay, fab. I think we'll get some results now, which we shall post. So we have a good mix for you, Kathleen. We have massage therapists, MLD therapists, lymphedema specialists, other, whichever that stands for. So, you know, who knows with that one. And then we have a vast majority, so 89% of us on here that actually currently treat patients post-cosmetic surgery. So brilliant. So with that said and that done, Kathleen, without further ado, I will hand over to you to start the presentation.
Thank you so much. So welcome. The presentation is called Improving Patient Outcomes After Cosmetic Surgery with Lymphatic Drainage. And I'll talk about lymphatic drainage and then a little more than that as well, because it's not just MLD. So I am a closed certified lymphedema therapist, an ACE certified personal trainer, a board certified massage therapist, and I'm author of the Plastic Surgery Recovery Handbook. The presentation objectives, we're going to list the goals of plastic surgery, very important to know, describe how our post-operative therapy can help clients, and we'll look at methods for gaining referrals from plastic surgeons. So first, I want to give you a minute to read and think a little bit about why you actually shouldn't help clients after plastic surgery if this career actually isn't right for you. So the big question I want to ask to make sure in your heart if this career is right for you: do people get plastic surgery because they're lazy, they're vain, they're insecure? And is this work helping the people just easy money? As post-op therapists, we're called to look beyond society's judgments and meet our clients with compassion and positive regard. And if you want to look at more about narrative medicine and collecting the stories of patients, these are some really, really good links that I would suggest you look into. So if we are ready to take this challenge, what are our goals? So I love Bella Avanesian's ideas about it. She's at the Mount Sinai Center in New York. And she is saying we should improve the patient's comfort with themselves and their personal experience. We want our clients to achieve a result that's both functional and has a natural appearance. And we want to minimize complications throughout the recovery process. So what's the most important outcome of liposuction? So this was a survey of 600 patients, and they found that the client's opinion of their appearance was the pivotal determination in their satisfaction with their liposuction procedure. So this is the first picture I'm going to have you look at. None of these pictures are of my clients. There are people who have shared their pictures with me over the internet. I feel like maybe like Petra is starting to have the same experience too. But as soon as you get out there and you start talking about it on social media, people are sending you their pictures. They're asking you how they should, is this all right? Is this safe? What should I do? So this wonderful lady is actually not even from America. She had her surgery in South America. She had 10 what she called lymphatic massages, but she said that they were normal pressure. So it was not a light pressure massage that we would think a water massage would be. She did have the water drained off of her, and I'll talk a little bit more about that later in the session. She had vitamin C injections directly into her stomach. And she just used a waist trainer for most of her recovery. She says, when she emailed me, she says, "I'm sorry to bother you. Can you help me? My doctor, she doesn't even answer me." So this is her result 1 year out of surgery. She says, when you feel her stomach, it feels like noodles and hard balls. So this is what I would say not a satisfactory result of liposuction. And this is what an example of what you can see from people who have not gotten an ideal recovery experience. So in America, there's a multidisciplinary approach to pretty much all other types of surgery. If you have orthopedic surgery, if you have, any kind of cardiac, any other system of your body needs surgery on it, they're going to refer you to a dietitian if they think you need dietary help. You will get prehabilitation before surgery to improve your results. Plenty of research backs that. And you'll get post-op rehabilitation after your surgery, especially orthopedic surgery. You just go and get referred to physical therapy. So my big question is, are we not referring our plastic surgery patients to fellow professionals, lymphatic drainage professionals, because the surgeon thinks they don't need it, or because it's not directly covered by their insurance? And I think it's the latter, especially in America, where some things are covered by insurance and some things are not. And if that is the situation, my big question is, what story is the patient telling themselves about aftercare as after your plastic surgery procedure? So if you're a surgeon thinking about, should I refer clients out to a dietitian if they need, like to lower their BMI before I send them to surgery? Should I refer them out to a manual lymphatic drainage therapist if they come to me and say, I've heard about lymphatic drainage, what do you think? The big question I have is, what are they telling themselves about the aftercare that you provide as a surgeon? So this is one example of kind of what I'm trying to get at. Colette posted in a Facebook surgery group. This is after her tummy tuck. She went to her surgeon for her checkup and was told she could stop wearing her compression garment. And then she posted on the group, I'm still not 100% healed yet and still so swollen at the bottom and top of my tummy. I really hope it corrects itself before my 6-month check. So this client is going to have months and months of healing when she's not going to have direct contact with her doctor and she's worried. This is just an unnecessary stress that we're putting on the clients when we could be instead referring them to lymphatic drainage and letting them see that there's a path to recovery ahead. So these are 2 more pictures. I was told by my teacher, I took close training and I had dinner with Gunter Close last year. And he said, you know what you really need? You need more pictures of clients. People really want pictures of clients. So here they are. In the black top here on the left, the lady is 5 weeks out. She went to her plastic surgeon and her plastic surgeon says, it looks good. Come back in a couple months, you're healing well. And she's understandably very frustrated because she said, it looks like my stomach is smiling at me because of those uneven lines and the waviness. The lady in the pink top, this is 1 year out. So this would be a final result for her. This is 1 year out after round 2 of liposuction. And she said she had no issues the first round, but and then she had a second liposuction procedure. And this is how her tummy feels. And just look back at the earlier slide where we said, what is the survey that says the number one positive result of liposuction, the determinant is how they feel about how they look. And this is her 1 year result. So why should we refer out to manual lymphatic drainage? I hear this question from surgeons, and mostly what my response would be is these are 2 liposuction textbooks, and the surgeons in these textbooks both recommend manual lymphatic drainage. I'm on LinkedIn, and I was just having a conversation on my LinkedIn with the former editor of the Plastic and Reconstructive Surgery Handbook, who says, I advocate for manual lymphatic drainage for my clients. So this is well known among the surgeons that this is a therapy that you can definitely recommend to your clients after surgery. And so if a surgeon was wondering, should I do this? What is the big deal? I get a question like, what's different from 10 years ago? Why am I suddenly hearing more about manual lymphatic drainage? Why are my clients coming to me with it? So I would say there's 2 reasons, particularly in America, are the average weight of a woman is going on to a higher BMI that's almost to the threshold for obesity. So it's like 29.9 is the average BMI of a woman in America. So our bodies have gotten bigger. And so that the idea that the liposuction surgery is something for someone who's athletic and just has isolated pockets of fat that's stubborn, that is still the ideal liposuction client, but is not the average liposuction client. So as you have clients with a larger BMI, you're going to encounter more issues as far as their recovery. It's going to be a little more complex, potential for comorbidities. This is where it's really valuable to have someone on your team or a referral source to help refer out. as far as swelling, what really happens during swelling? So this is a slide that I definitely put in for my lymphatic massage therapist, fellow therapists. So what happens is the canial actually creates multiple tunnels in the area of liposuction. And it's kind of like what you can imagine as a honeycomb. And then the pressure bandages, the compression, the faja that we're putting on them help to occlude those tunnels and push the fat back in so the client has a smoother result. That's why we're doing massage. In addition to reducing the swelling, that's another reason why the massage helps people. But there is a warning. Lymphatic massage is not just one thing, and you almost have to ask the person to define what they mean by lymphatic massage. So when I was educated, lymphatic massage means Vater style lymphatic massage. There are different types of massage from all around the world that call themselves lymphatic massage. And some people will push fluid out of an open incision and call that manual lymphatic drainage because they're just confused because the word drainage is in manual lymphatic drainage. So if you have a client that's coming and they're coming very soon after surgery, you have to make it clear with them what type of massage you're providing and make sure that they are wanting Vater style manual lymphatic drainage. All right, so how can we as therapists make a difference in the first weeks after surgery? We can reduce swelling in a lot of the same ways as we do for lymphedema. Manual lymphatic drainage, which you've learned, exercise and joint movement, many of the same joint movements that we would give to someone, especially in the legs to help that swelling come back up. Many of the same techniques that we would use on a client with lymphedema, you can use after the surgery. Diaphragmatic belly breathing, I'll always use as part of my manual lymphatic drainage massage. We prompt the belly breathing and the M positioning, and then that's at that point in the massage, I will tell people, belly breathing's really good. Like now that you know how to breathe with your diaphragm, doing it throughout the day is really going to help improve your lymphatic flow. External compression, we call it the faja in America, a medical compression garment. Kinesiology taping, which you can tape someone and put a compression garment over them. Kinesiology taping will really help. Also vibration and negative compression, and the combination of vibration and negative compression is in the Lymphatouch machine, which a lot of physical therapists will use for fibrosis and for lymphedema. And these two modalities paired together have some research behind them that they do help reduce swelling and fibrosis. So this is a slide, this is a comment that I want to use to introduce the fact that we provide more than just MLD. So this is Naz, and she asked this question in a plastic surgery Facebook group. She's 4 days post-op. She finds sleeping at night really, really hard. Her swelling's so bad. She didn't get any sleep tonight, 3 hours last night. She's worrying about her sleeping position. This is where we are perfectly positioned as massage therapists to help people with more than just manual lymphatic drainage. Like when we went to massage school, we learned how to massage the back and the neck and to reduce some of these aches and pains that happen when people are in a different sleeping position. And we can also help guide them, ask them questions about their sleeping, because sleep is so important for people to have proper sleep, helps people to improve their recovery. We know bad sleep, once you stop sleeping less than 6 hours in a day or two, over a day or two, it really reduces the body's ability to effectively heal from surgery. So what results can people get when they come to the therapist for massage after their operation? Reduce back and neck pain from the sleep changes. I do a neck massage on every single one of my clients. reducing tightness after surgery. Often I'll get people who say, I have this tight, heavy feeling. It feels like putty. It's really hard to stretch early in the morning. We can use some myofascial strokes to help that. Help resolve bruising faster because of the manual lymphatic drainage. The big one that I see is we can stop problems before they get out of hand. So what I see so often is someone comes in and their compression garment is fitting incorrectly. They're putting it on incorrectly. It's too tight, so they're not wearing it at all. And just simple things that we can do in the office to look at their compression garment will help stop any problems that they would see before they get out of hand, as far as if the fabric is bunching. You can give them something called a corset extender, which gives them an extra 2 inches in the abdomen of their garment. And sometimes that's enough over the first 3 or 4 days to help them fit into a garment that's too tight. And then once they shrink down a little bit, they can get back into that garment without the extender. And most valuable of all is a reinforcement of the surgeon's post-operative care protocol. And I hear this from surgeon after surgeon. Like, we give them a piece of paper, we talk to them at the pre-op, we talk to them at the post-op, but you know that people are very nervous in this surgical time. So they're not actually processing everything you say. And to have just another set of hands, another eyes on a set of eyes on your patient, another person that's reinforcing, you know, get your proper sleep, eat your food, go back for your visits, wear the faja. You know, if you have any questions, if you think this is an infection, like, just feel free to email your surgeon. Just send them pictures and they'll be so happy to help you. So the reinforcement of the surgeon's care protocol is something that we can do that helps both our patients and it helps the surgeon to get the best results for their clients. So the nitty gritty, the real details that people want. When do you start? For abdominoplasty, I usually start manual lymphatic drainage when the drains are removed, if there's no seroma, and usually the incision is covered with tape. My surgeons are pretty good at taping incisions afterwards, and then we'll bolster the client so they're not lying flat, they're lying at an angle. I have done MLD before the drains are removed and there's not an issue with it, but I usually see clients are very scared and they're babying their drains. They don't really want to have a lot of movement because they're not used to having a drain in their body. So I find that they're more mobile and they're more willing and eager to get a massage after the drains are done. After liposuction, Brazilian butt lift, I start 4 days after surgery. I could start 3 days after surgery. The main point is that the client's incisions are closed and they're covered with a Band-Aid or bandages and gauze during the massage. In a facelift, I usually start 1 week post-operatively. I have done work before the staples are removed, but usually the staples are removed and then the client's head is elevated by 2 pillows. In the first 2 weeks, I do mostly MLD because usually what we see is just the watery swelling. I'll use some hot stones in my hand, the hot stone, and then I use my warmed hand to massage the lady. And then, so the hot stone is not hot and on the client's body. I'll do some oil massage and then those myofascial strokes, as the client has told me they're feeling tight, they're feeling like taffy, to increase their range of motion. Especially helps if they have the liposuction on the arms or the thighs. If they're very, very tender, and they're saying their pain scale is 4 or 5 out of 10. I have a pain scale chart on my wall, and the pain is high for the MLD in the first week because they have the skin sensitivity. Then I will use negative compression. I'll use lymphatic cupping on them. Or else at the 3rd week, I use lymphatic cupping. That usually helps to clear out the putty swelling. And then after week 4, I'm using MLD, hot stones, myofascial strokes, IASTM. I'm trained in the Grasson technique. I've taken 2 of their trainings. And then lymphatic cupping, you can address both soft and woody fibrosis. I use the foam inside the garment is mandatory for my clients. I really like the liposuction foam. It helps to make sure a garment that maybe isn't fitting their figure correctly is not compressing them unevenly. I'll use complex ovals for spots of watery swelling. I have a plastic surgeon that I work with. He really likes the complex ovals. He buys them himself and he has them put it right over their belly button, because that's an area that can get like extra fat. It's like hard to liposuction right around the belly button. So having that complex oval has really helped him. Medi lymph pads. I love Medi lymph pads. Also a product called Edema Wear that I'll put on the arm or the leg if they can't tolerate their regular compression that they have, or they have some fibrosis in the area. And then that's the lymphatic alternating pressure profiles. There's something called a STRIDE document. You can Google it. It's s.t.r.i.d.e. and it's a document that's made, it was created, American therapists created it, and they're talking about the correct compression for lymphedema control and fibrosis control. So I get this ideas of the lymphatic alternating pressure profiles and the putty swelling and the woody swelling. That's a great document to take really a deep dive in, and I think it's available in PDF form on the internet. If someone has a breast augmentation or breast cancer history, I direct fluid to the inguinal lymph nodes. And then if they have the abdominoplasty, the actual watershed, they've removed the watershed below the umbilicus that was removed in the surgery. So the watershed that we're going to is the axillary lymph nodes. So this, in closing, this is my advice for therapists. You need to get the skills. You need to get a proper in-person class to learn about MLD. And then you should know the top problems and solutions involving the compression garments. The top ones I see is it doesn't fit correctly. There's too much fabric in the torso because the client is short or they have a short torso. And then also if it's too tight, then we can use the corset extender to expand it a little bit. Just knowing those two things and how to place the foam inside the garment so it covers the proper areas of the client can really help what's the word I'm using? Optimize the garment for the client and make it the most useful garment that it could be. And then know what else your clients are undergoing. Plastic surgery is never going to be a quick fix for them if they don't address the root problems of why they're getting the plastic surgery. So this is much clearer. If someone needs a rhinoplasty because their nose, after the rhinoplasty, there's no more issue and they can go forward. But if someone has an underlying issue and they're trying to use liposuction over and over and over again, there might be a deeper underlying problem, and that inviting them to look into that and then referring out to someone with the proper expertise that can help them. It can be a personal trainer, it can be a dietitian, it can be a health coach. So this is a big tip, gaining referrals from plastic surgeons. So what I use is a massage therapy care plan. So it's a document that I personalize for each client. I've given a link here of one good example, so you can just type that in and see one example, but there's several examples. And every time I have a new client, as part of how they sign to come and see me, they sign all the documents. One of them is I say, I am going to give information about our session to your surgeon. Do you allow me to do that? And then they sign, and then I'm able to deliver this massage therapy care plan, telling their surgeon, I saw your client, this is what I saw, this is what I did. This was their reaction the next day to it, because I email them the next day and say, how are you doing? And then I've had surgeons call me immediately back and say, this is great. I don't know. I didn't have a resource for my clients for a lymphatic drainage massage therapist. How many clients can you handle? And I say, absolutely. Here's my cards, give my cards out. You can also send an introductory letter to a physician. There's a lot of these versions of letters online. I have found, so I wasted a lot of money giving gift certificates that they could give to clients. I've had a lot better results giving them a gift certificate for someone on their staff that's having surgery. And then you get to have a direct contact into their office. That person gets to see your office, and they are going to give their honest response to the surgeon about, the quality of the massage and the interaction. And I've gotten surgeons who refer to me because someone on their staff came and had the MLD after the staff person's plastic surgery and came back and gave a glowing review to the surgeon. And then, as you see, if you follow me on YouTube and Instagram, I have an active presence, but I never tell you that there's a sale. I never tell you that there's a discount. It's all about giving information, because that's a huge issue with this client base, is they don't have enough information. They don't know everything that they need to know in order to successfully undergo and recover from plastic surgery. So that's where you as the expert can come in. And it's the tiniest pieces of advice that are really, really gems for these clients. So this is where you can find me. Again, I'm on TikTok, I'm on LinkedIn, I'm on Instagram, I'm just a little bit of everywhere. I also have CEU classes. They offer Nick Timba CEUs for therapists in America. Anyone can take them, but if you need the CEUs, they're from Nick Timba, and that's my approved provider number. And now I want to introduce you to Petra Irving, and she can definitely say more about herself, but this is 2 whole slides of how she's way, way more experienced than I am. So if you have any words to say, Petra, this would be great.
I don't really have much to add, Kathleen. You've covered everything perfectly. That I did notice there were a couple of comments came up about that Sue had mentioned about, that there are different, of course, MLD schools. So, it's not just Vauder, but, anybody that is in the MLD world, certainly in the UK, will be aware of that.
Yes. Yep. So ours, I'm thinking of Vauder style. So in America, it would be Close, Norton, Acoles, or the Dr. Vauder School would be the 4 main schools in America. So Dominic, do you want me to turn it over to you for some questions?
That'd be fab. Yeah. So first and foremost, thank you very much for the presentation. Very insightful for sure. And I hope it sparks a couple of questions coming in already. So just for those people who've got some burning questions, if you're going to submit any questions, please use the Q&A function at the bottom. Any comments you'd like to make, if you use the chat function, we can get a bit of conversation in there. Obviously, there's nearly 100 people on this call, so you can have lots of interactions. So please, any comments, pop it in there. When you are putting a question in, because we have got a variety of backgrounds in terms of location, so whether it's US or UK, before you put down the question, can you let me know whether you're based in the USA or the UK, and then I can direct the question accordingly and just make sure we answer the right information as best as we can. And yeah, any question is a good question, so please don't be shy. There's that burning question there. There's probably another 50 people on here probably thinking the same thing. So it's such a cliche, but it tends to be true.
Sorry, Dom, I just wanted to say that I have put in the chat, there are 2 articles that I found on Google Scholar that if anybody wants proof that to go to surgeons, that those 2 articles are in the chat box.
Perfect. And I think if Katie, who's doing the admin behind the scenes, she'll probably copy and paste those, and we can put those into the follow-up emails to people as well. Which when we come to close, we'll go over some information for people. But to sort of kick us off, this is basically in the UK, but I think I can open this up to both of you to comment on. So Sue Hansard, hi Sue, nice to have you on. She's based in the West Midlands, she's only down the road from me. So she finds it in the UK that surgeons generally don't recommend MLD to their patients, not until after surgery tends to be the case, and it tends to be a surprise for the patient. So I know you kind of already discussed about ways that you could approach the consultant, and do you think that's just comment on that? Is it just a case of getting to the consultant, educating them as well as the client, the patient? Kathleen.
Yep. So let me start, and then I definitely want Petra to chime in on this too. So what I've seen is I kind of have I have my heart with the surgeons, because I can also see the flip side of it is if you don't have the person's name, a specific person that you can recommend, they can definitely accidentally go into someone who doesn't have the proper education to do lymphatic drainage or help people after surgery. There are definitely some people out there, because it's being advertised as a way to make a lot of money. There are some people who can just say they're a lymphatic drainage therapist and maybe not give you the most effective treatment possible, or recommend, like way too many massages for what you need. So if I was to give a recommendation, I would say, yes, as a therapist, we should send out and start that communication with all our surgeons. And as a surgeon, you can definitely find, ask some questions about the therapist training and have a list in the office of a few different therapists that you would recommend that have the proper requisite training. So you can feel confident giving that advice over. So it's tough, because in everything else, like in America, if you wanted to send someone to a dietitian, there's a board and it's a registered dietitian, but it's not so much with someone with manual lymphatic drainage. Someone can take a weekend class and then come on Monday and say, oh yeah, I'm a post-op therapist. And, but especially buy a machine. There's something, especially with cavitation machines, radio frequency, we have a lot of questions about that in America. And there's some people will do something we call body sculpting, body contouring. That doesn't happen until 3 months after surgery. But I get a lot of people who say, there's a lady, she said she's doing lymphatic drainage, she's just using machines on me.
Yeah, I mean, Petra, from the UK perspective, do we see something similar here?
Yeah, I mean, I have started now becoming really active on social media again, and it's slightly horrifying, some of the things that you see. And I've come across now lymphatic drainage therapists that do wood therapy, which, it's just causing all sorts of inflammation. But I mean, that it's slightly getting away from the whole thing is about trying to educate people, and cosmetic surgery is getting so massive that all these people are on social media. And so it is constant education through those various channels, and then direct contact with the surgeons, and trying to also educate them on lots of them now are really open to MLD, but it is trying to educate them as to, getting somebody in within the first week after surgery, really, and getting the appointments booked well in advance, so that the patient is seeing a specialist MLD therapist.
Yes, and there aren't enough of us out there. So if you're booking and trying to get the appointment the next day, you're not. Like, my schedule is always booked more than 2 weeks out. So if you're looking at the last moment and trying to wait until the last moment, you're going to get someone who perhaps does not have as high qualifications as possible. If I was a therapist and I was looking, because this is a question I get a lot, how can I get into it? How can I start? As the baseline, the prerequisite, I would say a 40-hour in-person MLD class. The 4 big schools are close: Norton, Acoles, and Dr. Vodder School. Not anyone who just says they practice Vodder technique, but the actual Dr. Vodder School. And those have really good, high-quality in-person classes. And then from there, you can get additional training, head and neck lymphedema, stuff like that. And I would say you could have a massage therapist that uses wood therapy and does MLD, but we know that you don't do wood therapy on someone in the first 3 months after plastic surgery.
Cool. On the clinical side of things, so I mean, obviously education, I think we've covered quite a few of my questions that were pre-submitted anyway from other attendees about educating clients and the surgeons. But from a clinical perspective, Michelle Pryor has asked, now I've seen this on social media and I've always raised an eyebrow at it. So Kathleen, I'll ask yourself first, is why did therapists drain through open wounds, and is this acceptable practice?
So okay. It's out of my scope of practice as a massage therapist in California. It's also, there's a case with the Attorney General right now in the state of Florida. It's out of scope of practice for massage therapists in the state of Florida. It is done by surgeons routinely in the operating room. So there's nothing wrong with draining fluid out of the open wounds. If your surgeon gives you liposuction and and they don't stitch it shut while it's still open, you can definitely be in the shower and it will drain. It's fine. People will usually use pads to gather up any of the additional fluids because your body will naturally drain out of those incisions until they're closed. It's out of the scope of practice for massage therapists. So if you go to the surgeon's office and maybe the nurse is doing it, maybe the surgeon is doing it for you, again, perfectly, legitimate, because they are in a facility that has the proper cleanliness to assure that you don't get a infection from it. And then one of the other things which is very concerning to therapists is if someone takes a non-sterile instrument without the proper training and pokes and physically opens you up again and then drains some more. It's just opening the door for all kind of infections. And we know that there's a serious problem with the potential for infections after surgery.
And Petra, anything to add from the perspective? I know there's obviously the Instagram accounts that I've seen are UK based. I know that some of them that aren't nurses or anything, that there's massage therapist backgrounds. Is it a similar thing? Is that kind of thing generally out of their scope?
So when I moved over to England first 10 years ago and started doing MLD in London Bridge plastic surgery, there was a guy doing Vaser liposuction who I'm sure people have come across, Grant Hamlet. And he had a therapist who worked with him who was doing the quite aggressive pushing fluid out of the body. And so there was, from my perspective, it seemed counterproductive because it was going to be causing more inflammation and therefore more swelling. However, he seemed to be getting good results from it, and so she still works, I don't know, still works alongside him or not. I don't think there is anything to say that you can't do it in the UK. There's, as far as I'm aware, there's no body that would say you are not allowed to do that. But as an MLD therapist, you just wouldn't do it. Yeah.
And I mean, it kind of comes under regulation and regulatory bodies, which I know is a rabbit hole that we can fall down for a very, very long time, which we might discuss towards the end. I know I've got a couple more questions that come in. So Petra, just to yourself, from Helen Pilo, do you know what exactly the hardness that sometimes develops in a patient, and how can we help?
Well, it's fibrosis, so it's a form of scar tissue, and it's very common mostly after liposuction or Vaser liposuction. So, what is she, an MLD therapist? Is she a massage therapist?
Not entirely sure. If we presume that it's massage therapist or MLD therapist. Sorry if you're otherwise different, Helen.
So there are several things that you can do. You can do in the early stage. You don't want to do too much deep tissue stuff because you don't want to then cause more inflammation and then cause more fibrosis. Yeah. So you're doing MLD to flush out the tissues. I use the Lymphatouch, as you know, and I love it. It's very gentle, and instead of pushing into the tissues, it gently lifts them and vibrates them, and it separates the tissues. And then you're flushing out the cellular debris afterwards by doing your MLD. So I don't know about the Hyvamat, so I can't comment on that. And I know there are great proponents of it that are probably watching. So yeah, nice gentle treatment afterwards, and you just gradually are building up your depth of pressure as time goes on.
Well, I hope that answers your question, Helen. it kind of leads us on to another question that's come up, and I'm glad you mentioned Lymphatouch. Obviously, I know we work with Lymphatouch, how we know each other, Petra. Somebody's asked about lymphatic cupping, which I presume is obviously around Lymphatouch and those kinds of technologies. Anyway, I know there's other variations, but Lymphatouch is one of the main ones. So one person's asked, where can you be trained in lymphatic cupping? But then more to the point, Michelle Pryor is asking, what is lymphatic cupping, first and foremost? Petra.
Well, the lymphatic cupping, I don't know, but Kathleen, I think, does that. So.
Okay, cool.
Yep. So I was really lucky. I took an in-person lymphatic cupping class in San Diego. So we use the word lymphatic to further distinguish it from traditional Chinese cupping, which is in traditional Chinese medicine. And if you take the cup and you put it on the skin for a period of over 3 minutes, the Sha will come up. You'll get a nice red mark and you'll look like our Olympic swimmers with red marks all on their back. So lymphatic cupping is different from that. I'm using a pump function on my electronic cupping machine. So it's only putting the pressure on, it's only using the compression for like 1 second on, 1 second off. There's different kind of pumps, cycles, but the theory is we're just lifting and stretching the skin, which is opening those initial lymphatic capillaries and for a short period of time without actually kicking off any kind of inflammation, breaking any capillaries or anything that may happen if you leave the compression, that negative compression on for more than like 30, 45 seconds. So everything's on a continuum, right? Everything's on a spectrum. So if one side is Chinese cupping where you're leaving on for 3 minutes, then lymphatic cupping would be here where it's like 1 or 2 seconds or whatever. You can see that will make a change in the skin without giving you like a bruise or any petechiae, any kind of ongoing mark or inflammation. And then a little bit over here in the middle is like cupping that you would do for fibrosis. We know that negative compression, we learned this in the close training, negative compression for like 30 seconds, pulling up and twisting of the skin for 30 seconds will help to soften up the fibrosis, but we just can't get over into the traditional Chinese cupping, which is actually bringing the Sha up. Because the client is just too close to their plastic surgery for traditional Chinese cupping. Their body is using all of its resources to heal from the surgery. I don't want to give them an additional thing that the body has to heal from, whether it's the Sha from traditional Chinese cupping or it's a cavitation machine where you're breaking the cell of the fat cell and so then your body has to deal with, how do I remove these dead fat cells? So that's a big part of why we don't use machines in the first 3 months after your plastic surgery, and why some people, I've seen a lot of people emailing and saying, my lady did cavitation, they're doing this cavitation right after surgery, and now I feel like I'm getting fibrosis. What happened? I thought this was lymphatic drainage. So there's definitely a need in the public space that we need to talk about what swelling is and how you get rid of it, how you can reduce it, and what lymphatic drainage really is. Because just because a modality affects the lymphatic system, it does not mean it's equally as effective as the manual lymphatic drainage massage. A lot of things affect the lymphatic system. Even a regular Swedish massage can affect the lymphatic system, just like it can affect the circulatory system. But we have to use the best technique that we know in our toolbox to help these clients.
Fantastic. So I want to get into another question that's come through from Ida Friedman, which I think is a very poignant question, actually, is so Kathleen, to yourself, who obviously work with consultants, like, what do you do for surgeons that recommend MLD, but they're recommending in cases unqualified therapists? So she had a patient who had deep, painful MLD, is how she's coined it, with a provider that used baby oil after a tummy tuck, in which the doctor told them to go to that therapist. And I've lost the question. There it is. Sorry, I just moved on the screen then. But she went to IDA because she didn't like that deep work. So I think boiling that down is, what do you do to, you know, how can you approach those consultants that are potentially, you know, referring to therapists who are not necessarily qualified?
Yep. And I think the answer is contained within the question. This is actually the third way that I get a lot of surgeons to refer clients to me, and that is the actual client story. So we can send all the letters we want and show them all the research we want, but what really resonates with them is telling that client, thank you so much for telling me. Now you need to go at your 1 month, at your 3 month post-op and say, hey, look, you sent me to this lady. She caused me a lot of pain. I found this other lady. She is qualified, and this is my result with her. And that is going to have much more weight with the surgeon than it is, you know, if we tell them. So I would definitely, I've always empowered my clients. If you have a good experience, I'm sending the, you know, massage therapy care report to your surgeon. But definitely, if this is important enough to you, and usually it will be to clients, they'll be like, no one ever told me about this. I can't believe I didn't do this earlier. This is going to really, this should really help people. You need to tell more people about this. And I say, that's great. The first person you need to talk to is either the surgeon or, you know, your care coordinator, and tell that positive story. And, you know, I've had people bring my book to their surgeon, bring my cards to their surgeon and say, hey, you have to let people know about Kathleen.
Perfect. And I'll say similar kind of answer from yourself as well, Petra.
Yeah, I mean, I was quite active recently in a Facebook group, and there was somebody who had mentioned that she was going. I've always promoted MLD UK, and you know, if you want a qualified therapist in the UK, that is where a lot of them are listed. However, there are a lot of really good, really well qualified and really experienced therapists that aren't on the MLD UK register. So it is about doing research. And this patient had gone to, and I said, you know, let me know who the person is, because, you know, if they're an MLD therapist, it's likely that I'll know them. And I looked them up, and it was somebody that had done a 4-day lymphatic drainage course and was marketing themselves as a cosmetic surgery recovery specialist. Yeah. And I thought, holy shit. So then I'd said, you know, how is your treatment feeling? And she said, well, it's a wee bit uncomfortable. And so we got into a conversation in the group, and they didn't like me in the group because I had said that, you know, this therapist wasn't really aware that the anatomy of the lymphatic system changes after surgery. So, you know, you need to have the knowledge and experience to know that.
Yeah.
Absolutely.
Yep. And I try to ask therapists, I would be happy if someone asked me, like, when is the last webinar you attended? When was the last class? Because it started with the 40-hour class, and then I took a 135-hour class, and then I've taken all these weekend specialization classes in orthopedic solutions for swelling, head and neck lymphedema. I've been to all these conferences. Like, if you want to find a therapist that's passionate about this, that's going to give you the latest techniques that they have learned, they will be really excited to discuss their qualifications with you. I put my resume, my CV, it is on my website, and I list, you know, which classes I've taken, and I'm really excited about ongoing continuing education. So if someone is looking for a qualified therapist, I just let you know, like, just ask them about their education. They will be so thrilled to share it with you.
Brilliant. Just a quick note to people that we've still got quite a lot of questions coming in. So we've not got very long left, about 10 minutes. I'm just going to pick just a couple of like the hard-hitting questions. Any questions that we don't get round to, we're going to take them down. and we'll get them answered afterwards. So we know who's written them in. We've got your contact details, so we can get them answered for you. We might do a follow-up session as well. So just to get those questions answered. So apologies if we don't get them answered, but we're trying. There's loads coming in, which is fantastic. So we were speaking about this off camera, and I think this is a really hot topic. So Petra, I'm going to come to you on this first. Giselle Tucker has asked, that in the UK, what certification do you need for seroma aspiration? Do you need to be a nurse? And I mean, what are your comments on the seroma aspiration in general as well?
I mean, you have to be trained in doing it. So if anybody came to me with a seroma, I would directly refer them to the surgeon that had done the procedure. However, if, you know, a lot more people are having surgery abroad, so they're coming back home and they're, you know, getting issues then after they get home. So you've got to find somebody that's experienced in draining seromas, and it's not easy to do it. I've seen it done on numerous occasions. So yeah, I mean, ideally somebody that's experienced in doing it. You couldn't have just a GP clinical nurse, you know, because they're not going to have experience in draining seromas, as far as I'm aware. Somebody can correct me if I'm wrong in that, but I would definitely find a surgeon or somebody that is a clinical nurse specialist that is experienced in draining seromas.
Is that a ditto from yourself, Kathleen?
Yeah, it's out of the scope of practice for massage therapists. We're not trained in wound care. You have to have someone who is trained in wound care.
Perfect. No, brilliant. And then one of the other things, I mean, I know we've touched upon with people going abroad. Somebody's mentioned about they're having a patient going to Brazil, coming back. The one in the UK is that people go to Turkey and come back. You know, we kind of talked about more social media things and sort of not everybody's going to be social media savvy and doing that kind of thing. What is the best way from yourself, Kathleen, of just trying to promote more education to not only the consultants, but also to the client base?
Well, I've done a lot. I published the Plastic Surgery Recovery Handbook, and it's a lot of education in post-op, a lot of ways that you can improve your post-operative recovery. I did that because I saw that my clients on the table were like playing 20 questions with me and not enjoying their massage as much as I could tell that they were trying to like remember every single question they had. And I get clients before coronavirus, a lot of clients from Dominican Republic, Colombia, Tijuana, elsewhere in Mexico, Miami. So I said, you know what, I'm just going to put together a book that's a resource and give it to every single one of my clients. And they've been really happy with it. Usually in the second session, they're saying, oh, I read half of your book. Like, these are such good tips. Why doesn't anyone ever tell me this before? Yada, yada, yada. I also have online classes, which is in my links. I have a class which has a list of questions that you should ask your plastic surgeon about recovery. And I have a class that's a shopping list of things that are commonly bought to help you recover from the different procedures. And both those classes are free. So I usually, if someone has a lot of questions wanting to know about before surgery, definitely I would go and find the answers from an expert, whether it's a YouTube video, whether it's my classes or a book, versus just asking all the other ladies that have had plastic surgery. There's a lot of value to share your story and have friends and have social contact, but we need to know what the limits of social contact are. Like, when it's time to go to a doctor for advice, you go to a doctor, you don't just go to all your friends.
Would you agree with that, Petra? Yeah.
I went on mute because I've got a lot of traffic outside my window.
Oh, we can't hear anything, it's fine.
I'm going to be really honest, but I didn't actually hear your question, Dom. Oh, well,
it's not a problem. We can move on, because I think Kathleen gave us a pretty good, a very detailed answer on that anyway. So I've got pretty much one last one to sort of wrap us up There's quite a few people are mentioning about being MLD qualified as a massage therapist, and how do you get away from that? And people's asking about different courses that they can go on as well. I want to pick up on one of the points that you made, Kathleen, in the presentation about a network and building like networks. You mentioned about personal trainer, nutritionists, health coaches. Like for people who are either going to be new into this cosmetic sector, we've touched on how about the lack of regulation and those different things. So if you're trying to make it into this sector where there's clearly a gap, there's clearly a need for this. I think training and things are things that we're working on. I know Physiequip are looking at certain things as well to support. But I wanted to comment on like the importance of building a network. And if you're going out on there, is it just getting out onto your LinkedIn, looking at Google, like finding your local personal trainers, health coaches, consultants? Like how important is that if you're starting out, or even if you've been doing it for a while? How important is doing that?
I think it's essential, because just like we don't work by ourselves, we're telling the surgeon, like, don't just think you're the solution to every problem. Like, unless you have the proper training, like I'm a certified personal trainer, so I can give some guidance as far as personal training. But all the things that I can't give guidance for, I find a resource so that the clients actually have a trusted source that they can go to, versus just trying to get their question answered on Instagram or Facebook. So I think it's essential. In my most recent book, the Southern California Plastic Surgery Handbook, I partnered with a registered dietitian who gave me ideas and facts, so we can give our clients the expert advice that they need. I think it's really essential. Also, I'm really interested in the health coach, and having a health coach, qualified health coach in our referral network, because there's a difference between every single doctor telling you like you need to lose weight and exercise, and them being frustrated because they don't actually have the tools that they need, the techniques to actually get motivated and put the right tools in their life to actually achieve these goals. And that is the foundation. That's what a health coach is all about. So if you need to reduce stress, but somehow you can never get yourself to meditate, if you need to exercise more, but it's just not getting done, if you need to eat better, there's a million diet books, and we still have a crisis here in America. It's because people don't have those actionable strategies to actually implement the change in their life. And that is where a health coach comes in.
Perfect. And Petra, from your perspective, like building these networks, whether you're an MLD therapist or just a massage therapist, and building these networks, does that improve your credibility? Of course, going on courses and doing other CPD things, like obviously the webinar as well. Is things like that going to put you in better stead for building your clinic, building your practice?
Well, I mean, you want to be seen to be an expert in your field, and so the more information and knowledge that you can gain, that you can share with your patients and with colleagues, really is great. I mean, I stepped out of the lymphedema world and went into lifestyle coaching. So those are extra tools now that I have that I can share with my patients. So that you can't stop gaining more knowledge to benefit yourself as a person, but also to benefit your patients.
Perfect. I think that's pretty much all we've got time for, unfortunately. We still have quite a few questions to go. However, as I mentioned before, we've noted all these down and who's asked them. So we'll direct them to either Kathleen or Petra after the session and get those answered as soon as we can. And of course, if you've got any more questions, then you can reach out to us separately. So so I'd like to thank you all for joining us this evening in the UK, or this morning, wherever you are in the world, whatever time of day it is. I really hope you enjoyed the session. I know I did. I've learned quite a lot. I know we've only really touched the surface with it. So it's something that I know we're going to look to probably do a follow-up at some point. Thank you so much, Kathleen, for joining us, sharing your expertise. Petra, again, thank you for sharing your expertise as well and your knowledge in the area. So for everybody who's on following this session, you'll receive an email with a survey along with the link to the webinar recording. If you could just take 2 minutes to do the survey for us, give us some feedback, let us know what you think, and also suggestions for future webinars. We want to be able to deliver what you would like to see. So, you know, we kind of want to be really particular on what we're putting out. And we really appreciate those feedback and suggestions. In terms of upcoming webinars that we have in the UK, PhysiQuip. So we mentioned Lymphatouch a couple of times. If any of you are interested in finding out more about that, about negative pressure lymphatic drainage, we're running a fact-finding meeting on the device March 10th, 12:30 p.m. UK time. If you're in the States and you're interested in learning about it, obviously we don't cover that territory, but we can certainly put you in touch with people who do. The other thing I'd like to mention as well is we did a webinar in the past with a Professor James Moore Jr. or Jimmy Moore on the effects of positive and negative pressure on lymphatic pumping. So we'll put that link in the follow-up as well, because I think it's certainly one to look at. It's a very interesting session. And again, if you've got any further questions, please feel free to reach out to us on info@physiquip.com. Otherwise, thank you everybody for your interaction. It's been fantastic seeing all the comments and questions coming in. Kathleen, Petra, once again, thank you very much for your time and expertise.
Thank you.
Have a good evening, everybody. Take care.